I want to thank you for attending this webinar, and I want to thank Philips for sponsoring it. I would also like to thank Viva Learning Webinars. We're going to talk today about the big C, coronary heart disease, and its morbidity and mortality. Human lifespan has really hit an all-time high, and you can see, I don't know how many of us really want to live to 115 years. That is certainly not the average, but it is all because that we have had advances in treating and preventing diseases, and we also have improved social conditions. So what I'd like to do now is take a poll. And see where we are. Okay, you can go ahead and answer that. All righty. Well, these are the results of the poll, as you can see. And it looks like we had the most people say that heart disease is the answer. So let's continue on. By and large, you're right. And here are some of the statistics about heart disease. Heart disease has been the #1 killer of men and women in this country and really around the world for many, many years. However, things are changing. Here we see that heart disease is the leading cause of death among all women in the United States, but really by a very narrow margin, because what's happening is cancer is quickly taking over. And you can see here, this paper here compared the mortality burden of heart disease versus cancer among women by age, race, and ethnicity. And heart disease still kills older women, but in the younger women, it is cancer. And in some parts of the world, cancer has now overtaken heart disease as the #1 killer. As an example, our neighbor in Canada. So what is heart disease? Well, we know the heart is the hardest working muscle in our body. It supplies nutrients and oxygen-rich blood to the rest of our cells and organs, and the coronary arteries keep the heart itself healthy. So what is atherosclerosis and coronary artery disease? This is when the vessels in our body, the major vessels and sometimes the minor vessels, develop fatty deposits called plaque, similar to what we see in the mouth, and it can actually cause blockages or other kinds of things that we will talk about. So atherosclerosis can begin at a very, very early age. It's a progressive disease involving the development of lesions in the arterial wall. As they grow, these lesions can actually narrow or occlude the arterial lumen, or the space where the blood flows. As well, they can become unstable. They can rupture, and they can lead then to acute coronary events such as unstable angina, myocardial infarction or heart attack, and in some cases stroke. So it can be very, very serious. When I mentioned that heart disease, we're seeing it in children as young as age 2, well, why is that? That's primarily because of obesity. The kids now have very poor diet. They're sitting in front of a TV or in front of a computer, and according to the American Heart Association, they really failed to meet the standards set up for cardiovascular health. And as they get older, these young kids continue to have bad habits. So it even gets worse sometimes in the teenage years, and certainly when they start going to college and you know, are away from the parental influence. So coronary artery disease can affect certainly the heart, as we talked about with stroke or sudden cardiac death. It can affect the brain by way of stroke and the organs around the rest of our body. So what are the symptoms? Well, in some cases there are no symptoms until it's too late. Some people actually may have angina, and they get this checked, they take medication for it, and they become very aware if they have any unusual feelings in their heart, if they have shortness of breath, or if they've already had a minor heart attack. As we get into the more serious diseases, there can be severe chest pain, there can be heart failure, and if somebody has actually had a heart attack, they will have scarring in their heart because of the death of the heart muscle. It is the most common type of heart disease in the United States, and coronary artery disease, in some cases, the first sign, unfortunately, will be a heart attack. So this is something that it behooves us to learn how to prevent this and to recognize the signs early. So what are some of the risk factors of this? Well, one of them is high blood pressure. I think we're all aware that high blood pressure is something that we all want to avoid. If we have it, we need to try and get it in the normal range. And you can see here that the normal range is about 120/80 millimeters of mercury. If you are at high risk or with high blood pressure, you may have to take medications to control that. Recently, there was a study that showed that vegetarians actually have a lower incidence of hypertension than non-vegetarians. This probably doesn't surprise us because we know that having a good diet is very, very helpful. But this diet actually reduced the risk of hypertension independent of other risk factors, and we'll go into some of these risk factors as well. So what about in the dental office? I am sure that most of you, and there are quite a few of you on this webinar, are taking high blood pressure readings in the dental office. It's important when we do this to position the patient properly. And if we have baseline recordings, we want to make sure that the patient is relaxed and seated with their back and their arms supported. They shouldn't be conversing, they shouldn't have their legs crossed, and the midpoint of the upper arm should be at heart level. When the arm is below the heart, the reading could be too high. So the other thing is the new digital devices, they won't even work unless the patient is positioned properly. And the other thing, according to the American Heart Association, is that the cuff needs to be the right size. Apparently, this is a very common error. So choose the appropriate size cuff based on the circumference of the patient's bare arm. The bladder in the cuff should encircle about 80% of an adult's arm and 100% of a child's less than 13 years of age. So this might mean that we have to have a couple of different size cuffs in the dental office. The other thing we need to do is look at the health history. These are very common types of drugs that people with high blood pressure will be taking. Diuretics, ACE inhibitors, alpha and beta blockers, and calcium channel blockers. So if we see things like Lasix or Cardura or low pressor, we can be sure that they're being treated for high blood pressure. There also have been links studies that have been showing links to periodontal disease and hypertension, and they actually relate this back to the bacterial burden that was positively associated with both high blood pressure and prevalent hypertension. So we also know that when people are taking a lot of medications, they certainly can cause dry mouth and other kinds of issues. I just want to make you aware that there is a new toothbrush, a fairly new toothbrush, offered by Philips Sonicare. It's a Bluetooth-enabled brush. It has an app that you can use on your device, like your mobile phone, and it highlights the areas of the mouth that are being missed by the patient. And it assists them with their brushing technique, and it actually makes the removal of plaque 7 times more accurate than using a manual toothbrush. And the app is available for Apple Android users. They have what they call smart sensor technology. It can provide feedback to the patients, which helps them to know spots that they're missing, locations in the mouth that they're missing. Their sensors also can tell them if they're brushing too hard or with too much pressure. And there's also a timer that encourages them to move to each segment of the mouth at the appropriate time, and that's also called a brush pacer. So they can also set daily goals, and really it's kind of like a personalized coach, if you will. So it reminds them about many things, and the important thing to remember is 87% of the users surveyed after just 1 week, they felt that they were better brushers. So this is really important, I believe, in helping people to do their best at home when we're not there watching them. If you'd like more information about guidelines for monitoring blood pressure in the dental office, there are, through Dentistry IQ and through other journals, there are some guidelines that are available for you. So as we continue, another risk factor for coronary artery disease is cholesterol. And cholesterol is a soft, waxy substance found in our body. And we know that there's good and bad cholesterol called LDL and HDL. And there are also triglycerides. Triglycerides are different types of fat also in our body. So let's take another poll here, and we will take poll 2. What are the 2 main sources of cholesterol? So here you can see the results here of the slide. We have 30 with A and about 20 with D, and the answer is really A. So we will go on to the next slide here, and this kind of gives you the answer. So cholesterol, as I mentioned, it's a soft, waxy substance that's found in our body. It's in our bloodstream, and it's in all of our body cells. Everybody needs cholesterol. It serves a vital function in our body. It's a component of nerve tissue of the brain and of the spinal cord, as well as other major organs. And we get it in the 2 ways that you see here, through our liver, which produces it, as well as from the foods we eat. The foods, by that I mean our animal products and meat products, milk, cheese, and other types of meat. So it's often measured so that we know where we stand to promote our health and to prevent disease. So we'll go into that and what the optimal numbers are. And one thing to remember is that it can help to form the plaque that's in our vessels, and cholesterol and other fats don't dissolve in the blood. They actually have to be transported to and from cells by special carriers, if you will, and these, you've probably heard the term before, lipoproteins. So here are the optimal levels of cholesterol. Total cholesterol should be below, to be optimal or desirable, we want it to be below 200 milligrams per deciliter. And then you can see whether you have borderline high or high. The LDL is a separate reading. This is what they call the bad cholesterol, and we would like it to be below 70 milligrams per deciliter. And then the good cholesterol, or the HDL, actually can carry the bad cholesterol from your body to the liver for processing. And we would like this to be above 60 milligrams per deciliter for the best results. And triglycerides is another type of fat in our blood that cannot dissolve, and so we would like desirably to have our levels be below 150. Certain countries have different guidelines, and these are basically the U.S. guidelines. They differ very, very slightly from those in Canada and in Europe. We mentioned earlier that children they're having cholesterol issues starting at the age of 2. So the National Heart, Lung, and Blood Institute recommends cholesterol screenings starting at the age of 9 or 11, and then again at 17 and 21. This is, of course, dependent on their health history and their hereditary background. If they have a parent or a grandparent with a history of cardiovascular disease or cerebrovascular diseases, especially if these have been manifested before the age of 55, these children need to have special attention. They may need to be tested earlier, and they may need to be tested more frequently. So kids are not immune to this. Another risk factor, diabetes. The risk of death from diabetes for adults that have it, and this is in most cases uncontrolled, is 2 to 4 times higher than those who do not have diabetes. And this is data from the Center for Disease Control. About 2/3 of the people with diabetes die of some type of heart disease or blood vessel disease. And at any given cholesterol level, people with diabetes have a 2 to 3 times higher risk of a heart attack or stroke. Again, even if they have low cholesterol, they're more likely to die of a heart attack than somebody without diabetes. And 80% of people with diabetes die from heart disease. So this is a very serious issue with people with diabetes. And this in particular is very alarming, if you will. Risk of sudden death from a heart attack for a person with diabetes is the same as that of someone who's already had a heart attack. I think we all know that if we've had cancer, as an example, we're more likely to get cancer again. If we've had a heart attack, we're more likely to have a heart attack again. So this statistic is pretty telling here. So people with diabetes really do need to kind of take note of their health. So here are some of the other risk factors, our behaviors. These things we can change. You can see here our diet that is too high in fat and salt if we are physically inactive or obese, and alcohol and tobacco and stress. Drinking too much alcohol can raise our blood pressure levels and, of course, then the risk of heart disease. It also increases the level of triglycerides in our blood. Alcohol consumption, if it's in small amounts, and by that I mean 1 to 2 drinks, can actually be helpful and actually can be a vasodilator. But after you have 3 or 4 drinks, it changes. It becomes a vasoconstrictor. And apparently it's a really fine line between that. And the other kind of risk factors, certainly stress because of the cortisol that stress induces into our bodies, and sex hormones. By that I mean, for instance, women lose natural estrogen or estradiol as we age, and this can increase our risk of heart disease. Kind of in relationship to that, having hormone replacement therapy has been found not really to help. So it is the natural estrogens in our body that appear to be helpful, not necessarily taking hormone replacement therapy. People who are obese have 2 to 6 times the risk of developing hypertension, even if they have no other risk factors. And so if somebody is overweight or obese, there's a lot of risk. And why is this? Well, one of the reasons is obviously we're carrying around more weight, which might be good for the pressure on our bones, but it is not good for our cardiovascular vessels or our heart. The other thing that we have known through the years, or have learned through the years, is that the fat in our body doesn't just sit there. We have in our body mostly white fat. Unlike animals that go into hibernation, they have brown fat. The brown fat actually releases energy, whereas white fat stores energy. And what happens is the fat in our body doesn't just sit there. It actually releases pro-inflammatory mediators. So if you are obese or overweight, you're in a constant state of low-grade inflammation. And I think we all know what inflammation does to our bodies. So it's something to really be aware of as far as obesity is concerned. The other thing that plays into this is the shape that we are. If we are pear-shaped, that's a good thing. We store the fat on our hips, our thighs, but The important thing, it's just below the surface of the skin. The apple-shaped people, we store fat around our abdomen, around our chest, and it surrounds our internal organs. So it's called visceral fat. And that is much more dangerous, if you will, for cardiovascular and heart disease. Other risk factors are our family history, something that we can't change. We can't change our genetics. We can't change our heredity, our age, our sex, our race. We can't do any of that. So we know that heart disease is the leading cause of death in the United States for non-Hispanic whites and blacks and American Indians. And for Hispanics, Asian Americans, and Pacific Islanders, heart disease is now second to cancer. So cancer has taken over in that ethnic group. If you'd like to find a little bit more about your family history, here's a good website. What you do is you enter information that they ask for. It will then give you information about your risk. You can then share that with your physician. You can share it with the rest of your family. So it's important that we know what our risks are. If we don't know what our risks are, if we don't know our numbers as an example, there's not a whole lot we can do to change that. The other thing to remember is that if you have more than one risk factor, you're at higher risk. It kind of goes into a continuum. So the risk is amplified or enlarged, if you will, if you have many different risk factors. So the important thing to know, you can have a number of risk factors, and that is more important than if you have a very modest or a marked elevation in a single risk factor. Let's say you have extremely high blood pressure, but nothing else. But on the other side of the coin, you may have moderately high blood pressure, moderate high cholesterol, those kinds of things. You actually are more risk. So again, lots of websites available that we can look at to learn about how to minimize our risk, which we'll go into as well. So how do we prevent heart disease and cardiovascular disease? Well, we want to look at our diet. There are certain things that we can change. And diet is one of the things that is extremely important. Eating fruits and vegetables, go back to a vegetarian or even a vegan diet. And the more colorful they are, the better it is. We want to eat grains, but whole grains when necessary or when possible. And choosing low-fat or non-fat products and things like low-cut fats of meat, chicken, fish, except, and we'll go into this as well, some fish has omega-3 fatty acids, which are very, very healthy. The one thing you do need to be careful about with non-fat and low-fat products, some of them have a lot of extra sugar, so you just need to be sure that you read the label and make sure you know what you're getting. You want to eat things that are healthy for us, healthier fats, trans fats not being one of those, and limit dietary cholesterol. So these are things, alcohol in moderation for the reasons that we already discussed. We want to have a diet, we want to decrease sodium and saturated fat and trans fatty acids in our diet. These are all linked to high blood pressure and then therefore an increased risk of heart disease. Omega-3 fatty acids, which we find in fish like salmon as an example, they can actually, as well as soluble fiber that we can take, actually help to lower cholesterol. And of course, then that will lower our risk of heart disease. This was a very interesting study that was just published a couple of weeks ago. A lot of us, especially women who are prone to osteoporosis, take calcium. And what we know now, that taking calcium in the form of supplements could raise the risk of plaque buildup in the arteries and cause heart damage. That doesn't hold true for a diet that's rich in calcium-rich foods. So why is that? Well, according to the researchers, and this was the multi-ethnic study of atherosclerosis conducted by the Johns Hopkins researchers, they feel that ingested calcium supplements, particularly in older people, don't ever make it to the skeleton where we think they're going to go. They never really actually get completely excreted in urine, so they must accumulate. And according to them, they feel that they then accumulate in the body's soft tissue, like the vessels. They know, according to them, that as the person ages, calcium-based plaque builds up in our bloodstream, the aorta, other types of arteries, and as we mentioned before, this can impede the blood flow, causing either an MI or a stroke. So, you know, it looks like now we stop taking calcium and try to concentrate instead on eating calcium-rich food. So what are some of the other things? Well, losing weight, that stands to reason. If obesity keeps us in a constant state of inflammation, we want to lose those pounds. We want to exercise, and we definitely do not want to use tobacco products. To help us with this, there are dietary guidelines, fairly new. They were released last year, so they're the guidelines 2015 to 2020, readily available on the website. And we also have ChooseMyPlate.gov, which gives us guidelines as well. What the guidelines tell us is that we should limit total daily consumption of added sugars to less than 10% of calories per day. As oral health care professionals, we know that sugar is really harmful to the mouth, but it is also harmful to the rest of the body. Eating healthy, we want to keep our calories to 35% or less, total calories from fat, with 10% or less of saturated fat. So keeping that very, very low. And sodium, you know, 2,300 milligrams a day is not much. So look again at labels, because almost every canned or packaged type of food has a lot of sodium in it. So you really want to look for instance, low sodium broths or soups or things of that nature. And coffee, people go, the pendulum swings on this one. Coffee consumption is actually fairly healthy for us. We can have 3 to 5 8-ounce cups a day, but again, not if you're a child. Children that drink coffee have to be careful, because caffeine is not good for children. So this brings me to something that is a kind of a sore subject with me, but we need to talk about sugar and soft drinks as it relates not just to oral health, but general health. This has become such a problem in our communities that many organizations, dental organizations, dental hygienist organizations, and other groups have started programs. Here's one called Stop the Pop, and there are others that are available that give us helpful things. So let's look at this. American consumption of soft drinks, including carbonated beverages, fruit juice, sports drinks, iced teas, things like that, have increased 500% in the last 50 years. We spend billions of dollars, and this equals 1.6 12-ounce cans per day for every man, woman, and child. And you might say, well, I don't even drink soft drinks. Well, that means that somebody else is drinking your share, because this is an average. We drink more than 53 gallons of soft drinks per person per year, surpassed by every other kind of beverage. And because of this, other more nutritious beverages are kind of falling by the wayside. Kids used to drink more milk, but now they're drinking a lot more soda pop than milk. Teens are drinking twice as much soda. 20 years ago, they drank twice as much milk. So, not everybody can digest milk properly, but certainly it's probably a better choice than soft drinks. The other thing to consider is the size change. Look at how these sizes have changed in the last 50 years. You can see here in the 1920s, small bottle of Coca-Cola. But now, look at it. We're talking in the 1990s, they've introduced the liter bottles. Now, most people don't sit down and drink a liter bottle, but they will sit down and drink a 20-ounce bottle. So we really need to watch our consumption as far as the amount. So what about the overall health implications? Well, soda in America is the single biggest source of refined sugar, and teenage boys get 44% of their 34 teaspoons of sugar per day from soft drinks. What is recommended? Not any more than 6 or 9 teaspoons a day. You can see here, girls are getting 40% of their 24 teaspoons from soft drinks. So this has become a real issue in our society. It is healthy. It's not healthy. It's empty calories. So for an example, for someone that is a healthy person, about 120 pounds, they eat a good diet, they exercise, if they drink one 20-ounce soda every day, it can contribute enough calories to equal 27 pounds per year. It would take 2 hours of moderate walking per day to burn off the calories from one 20-ounce soda. I don't know about you, but I certainly don't want to have to walk an extra 2 hours to work off a soda. It also, Mountain Dew as an example, 20 ounces has 19 teaspoons of sugar. So if you drink just one bottle a day, that's 1.4 pounds of sugar per week. Just think about a 5-pound bag of sugar. If you're a baker, you'll know this. That is what you are consuming per month if you were having one Mountain Dew per day. You're also getting the equivalent of an adult dose of No-Dose. And for those young people that may not know what No-Dose is, it is a caffeinated pill that people take to keep them awake so they don't fall asleep or doze. So again, it's not so bad for an adult, but if kids are drinking these kinds of things, it is not healthy for a child to have that much caffeine. The other thing to keep in mind is the calcium. Some of the chemicals in soft drinks actually leach the calcium from our bones. We already know that many of our teenage girls and boys don't have the recommended calcium intake that they should have. And what this does is it puts them at risk because we all peak out at about 25 to 30 years of age. This is when we're at our peak bone density. And then we all start to lose. We just do. That's just the way our bodies are. Women tend to lose faster than men, especially after menopause. However, if you don't go into your peak calcium years, 25 to 30, with optimal bone density, you're going to be behind the 8 ball. So you want to make sure that our teenagers are getting enough so that they are healthy, that their bones are healthy before the years when osteoporosis and osteopenia start to happen. Soft drink consumption has been linked to many other things: diabetes, kidney stones, heart disease, as we're talking about, osteoporosis, dental decay, and, of course, obesity, which we've already discussed to some degree. Obesity is becoming an epidemic, and it has been rising in tandem with soda consumption through the years. With children, it's doubled in the last 10 years, and now almost a third of children and adolescents are obese or overweight. And these children, in most cases, will remain obese as an adult. And this is causing so much morbidity and mortality. It's costing our society billions and billions of dollars. Here was a study done in Boston that showed that for each additional daily serving of a sugar-sweetened drink, the incidence of obesity was significantly increased. And the odds of becoming obese increased 1.6 times for each additional can or glass of sugar-sweetened beverage. And we know already that so many of our children are already obese. And an extra soft drink a day increases a child's risk for obesity by 60%. Here was a study here. This was published in Circulation, which is the Journal of the American Heart Association. And they talked about, this is a statement, added sugars and cardiovascular disease risk in children, poor lifestyle habits, whether it's the diet or lack of exercise. These sugars, they contribute to a diet which is called energy dense, so we're storing more energy than we're expending, nutrient poor, and it increases the risk for obesity, cardiovascular disease, high blood pressure, cancers, and dental decay. So the conclusions here, even the association with added sugars and increased cardiovascular disease risk factors they're present at far lower levels, and that's because kids and teenagers are consuming much, much more than what is supposed to be the daily average of sugar. So what they recommend, you can see here, 6 teaspoons of added sugar a day. If you just have one soft drink with 17 to 19 teaspoons of sugar, you're way off the chart already. So yes, you can have sugar. We can all have sugar, but in moderation. And for children under the age of 2, you really, really should minimize the amount of sugar because it really does not help in their growth. So we really need to try to get these kids into better habits. Sugary drinks have been linked to that apple-shaped or visceral fat. So regular sugar-sweetened beverages they were associated with adverse change in both the quality and the quantity of visceral fat. But they didn't see the same kinds of problems with diet sodas or drinks that were sweetened with other types of sweeteners. So, again, this is really an important thing. We have increased in the last 50 years our sports drinks, fruit juice, sugar-sweetened beverages by 500%. Something to keep in mind. Here is something that, this was another program in California where it was a program to help with obesity, and soda consumption was linked to obesity. And here are some of the numbers. 22 teaspoons of added sugars we consume daily, 17 teaspoons of sugar in a 20-ounce bottle of soda, 43% of additional calories that we've been consuming in sugar from soda since the 1970s. 50 gallons of soda. So you can see there, I'm not going to go through every single one, but 450 types of drinks are produced by basically the 3 big soft drink producers. So there are numbers. We have to know these numbers. It's very important for us. Again, the other thing to keep in mind is the increase in size, not just of soft drinks when we're talking about obesity, but in food. We look at the sodas from 6 or 7 ounces to 42 ounces and big gulps and things of that nature. Hamburgers, now it's almost 3/4 of a pound of meat in a hamburger. And French fries, you can see from 2.4 to 6.7. So, very, very, I don't know about you, but it's very difficult for me to go out into a restaurant and have a meal that I either don't split with somebody or take half of it home. Our portions are way, way too large. And this is just a visual here, and I think if you're teaching children or even adults for that matter, if you give them a visual of how much sugar in, for instance, even a 12-ounce can of soft drink, how many people put this many, 10 teaspoons of sugar in for instance, coffee or tea? It doesn't seem the same. We drink the soft drink because we're used to it. But look here, look at the gulp drinks. So just another visual. Here's another one here. And it's not just soda we're talking about. We're talking about sweetened waters. We're talking about Snapple, nectar-type juice drinks, energy drinks, many of the others. And here is just a chart to show you that a sip of soda impacts our health. We know that it can cause tooth decay, can also dissolve tooth enamel. We're talking about the fact that it increases risk of heart disease. It does cause asthmatic problems in people with asthma and kidney issues, sugar overload, diabetes, all of these things, obesity. Soda is definitely one of the things that we can try to eliminate from our diet to help us lose weight. Obesity has become so much of a problem, and sugar, that in Australia, as an example, they really feel that this is a very serious problem because 2/3 of Australian adults are overweight or obese, and 1/4 of their children are. So their goal is to cut sugar use by half. And so they have a plan, and they want to empower families. They want to give them the tools they need. They want to really focus on childhood obesity and perhaps even tax soft drinks. I know that is kind of controversial, but marketing properly to children when they're watching their cartoons and things like that. And also improved food labeling so we know what we're getting into our bodies. So benefits of cutting back: we lose weight, we sleep better, we have improved energy and health, and even our mood can change. And so this is in Australia, but there's a lot of information available here in the U.S. And this is not just in the U.S. or in Australia. This is around the world. The World Health Organization has a guideline, sugar intake for adult and children, and they recommend reduced intake of free sugars throughout the lifetime in both adults and children to less than 10% of total energy intake. And that's a very strong recommendation. They really would like to see it below 5, but that is what they consider conditional recommendation based on the data. There is also a World Obesity Day aimed primarily at children because, again, the prevalence of obesity is very, very high. This just happened in October 11th, 2016. So you can look for information, and there are tools available if you want to start something in your own community. Okay, so we're now going to do another poll. All righty. Are diet drinks a better alternative to sugary drinks to reduce the risk of heart attack and stroke? All right. We have a lot of smart people here. A lot of smart people. The answer to that is no. Here is a study that was done, and it tells us that drinking 2 or more diet drinks a day may increase the risk of heart disease, including heart attack and stroke, in otherwise healthy postmenopausal women. Those who consume 2 or more a day were 30% more likely to suffer a cardiovascular event and 50% more likely to die from related disease. Now, bear in mind, when you're talking about things like diabetes and things like that, yes, a diet drink might be healthier than the sugar, but we have to look at our whole body. So, there are studies on both sides, and there are different types of sweeteners. There's stevia, there's aspartame, there's all kinds. So, I think it's important for us really to understand the different types of sweeteners that are available and what they do to our bodies. So, in one study, the research subjects, if they consumed 1 daily serving of diet soda, had a 36% greater risk of metabolic syndrome. Metabolic syndrome is kind of pre-diabetes. High blood pressure, high sugar, abdominal obesity, or that apple shape we talk about, and high triglycerides in the blood, which we know increases our risk of heart disease and cardiovascular disease. And also, people who consume diet soda daily have a 67% higher risk of type 2 diabetes. So we really have to look at this. And the researchers, it's kind of counterintuitive, but they think that it could be due on the effect of the sweetener on insulin resistance and glucose metabolism. So in this particular study, each participant indicated that they drank none or light or daily soft drinks. And at the end of 10 years, the daily diet soda drinkers were more likely to have a heart attack or stroke or have died from vascular disease. So there are many, many studies regarding this. So let's talk about labels. It's really important. You look at a label, and the first thing you want to look at is the number of servings in a container. So here, if you're, for instance, yogurt as an example, you may have 2 servings. So if you're looking at 250 calories per serving, then you're looking really at 500 calories. So really know the labels. Again, there are all kinds of guidelines online. You want to limit fats and cholesterol and sodium, and you want to make sure that you're getting enough of the good nutrients. The other thing, oils and fats. Saturated fats primarily come from animal products, whether it's butter or cheese or meat. So we want to avoid them or eat them in low quantities. The monounsaturated and polyunsaturated fats are good for us. Things like olive oil, canola oil, sunflower oil, as well as the fats that we get, the omega-3 fatty acids that we get from things like fish and things of that nature. Now, there are a lot of people that also take fish oil, which isn't a bad thing. It does help in individuals that have heart disease risk, but bear in mind that it does thin the blood. So if you're going in for any kind of surgery or have any kind of clotting issues, you really need to be careful with those supplements. We want to exercise. We want to maintain a level of exercise that is in keeping with the number of calories that we eat, because it does help us to increase our good cholesterol, decrease our bad cholesterol, and the risk of obesity. It increases our sleep quality. It decreases our resting heart rate and does a lot of wonderful things. And probably the most important thing, it can give you about 4 years. So exercise is extremely important. Mortality is halved in retired men who walk more than 2 miles a day. Regular exercise is so important for everything. And somebody that's inactive has as great a risk of having heart disease as someone who smokes, who has high blood pressure or high cholesterol. So we really want to be sure that we're exercising. It significantly reduces our risk of cardiovascular disease and can reduce our blood pressure. Wonderful, wonderful benefits. It improves our memory, our energy, controls our weight, improves our mood, all of these kinds of things. And it's not complicated. You know, you don't have to go to the gym. You certainly can, but you don't have to. But just walk, making sure that you walk properly and you have the best shoes you can for walking. And of course, we don't want to be using any kind of tobacco product, because as we stop using these products, our risk of heart attack starts decreasing, and after 2 years, you actually reach the level of a non-smoker. So it's very, very important, not only for us, for our patients, to counsel them not to smoke. Reducing cholesterol, 10% reduction of blood cholesterol produces a 20 to 30% decline in cardiovascular disease deaths. So very important. And there's a lot of information online about heart disease, about cholesterol, and about blood pressure, which we've also already talked about. The other thing is controlling our blood sugar. If we have diabetes, of course, we're checking our blood sugar. It can be fasting blood sugar. It could be after we eat. And the other kind of thing is to modify our lifestyle as best we can. And some of us may need to take medications, and that's okay. We need to do that as well. If somebody in your family has already been diagnosed, that doesn't mean you're going to have it. Yes, your risk is a little bit higher, but if you do all of these things that we've talked about and take the medications that you're prescribed, you will do just fine in most cases. Heart disease is often avoidable. So heart-healthy lifestyle, heart-healthy diet, really, really important. Let's do one more poll before we end here. We're going to do poll 4. All right. Does anybody know what the Widowmaker is? Okay, well, I see here. I really didn't know a lot. This is the answers. And I will tell you that it is actually the left anterior descending artery which supplies muscles to the heart. And unfortunately, I'm very aware of this because we recently had a friend of ours pass away. You can see it here. And he was 49 years of age, and all he had was some slight indigestion. Patients who develop this blockage can be treated. Unfortunately, they usually don't know it until they have a heart attack and they pass away. Here are some of the symptoms that, nausea, shortness of breath. As I mentioned, some people think they have indigestion. So if you have these symptoms that last for a while, you want to get it checked. People say sometimes it feels like the flu. There are lots of videos online that you can look at and to learn about the widowmaker. Also note the symptoms of heart attack. They're different in men and women. The big thing with women is chest pain may not be present. Sometimes people with heart attack, they feel like they just have weakness, fatigue, headaches, things of that nature. There's a lot of online information for women in heart disease, the Heart Truth, and Million Hearts as well. Some of the signs we'll talk here, we did talk about this a little bit already, but just bear in mind, half of the men who die suddenly have had no previous symptoms. The men often get the symptom of, extreme chest discomfort or the feeling of an elephant on their chest, stomach pain, shortness of breath. So just be aware. Men have an average of their first heart attack at the age of 66, and they do have a greater risk of heart attack than women. One of the things to be aware of, that plaque forms differently. It's easier to see in men because it tends to form in clumps, where women's tends to form more kind of in the vessels differently, so it's harder to see. One of the ways you can tell your risk is to have a calcium score test, which is known as a heart scan. It calculates your risk of coronary artery disease by measuring the amount of calcified plaque in your arteries. If you're considering taking high cholesterol med, things of that nature, then you may want to take this test. Some people don't need it. If you don't need it, don't take it. Just check with your doctor. If you aren't at risk, then you really don't need to take the test. After you take the test, you want to be in the low range, because the higher it is, the more amount of plaque is visible in your vessels. Don't take a chance with a heart attack. Know what the symptoms are. Call 911, but be careful if you're calling from your mobile phone. They don't know where you are, like when you call from a landline. So tell them where you are, what kind of emergency you're having, and provide them with your wireless number. It's really important that you do that. Know how to use an AED. Again, you can save somebody's life. Philips has a wonderful AED and instructions on their website. And don't delay. Call 911 if you're at all concerned. And lastly, we want to talk about a stroke, because strokes are very, very deadly as well. Sudden confusion, trouble speaking or understanding speech, sudden weakness, especially the face, the arm, the hand on one side of the body, vision problems, double vision, sudden dizziness, loss of coordination. These are all things that we need to look for stroke. 911 is the best choice there. We can sometimes see carotid atherosclerosis by our Panorex, so there are all kinds of studies available. And there has been a link between dental and coronary artery disease. People with more calculus developed angina significantly more than patients that were healthy. So again, there are links. Gingival inflammation associated with stroke, a number of studies to support that. And periodontal disease has also been linked to oral cancer. So we know that there are links between periodontal disease and heart disease, and according to the American Heart Association, observational studies to date support an association, but not a causal relationship. There is a wonderful new blood pressure cuff that is available. It's a smart app, if you will, and it gives you all kinds of, measures your heartbeats, it gives you triple measurements so you get an average, and it measures your results against the World Health Organization chart. And lastly, there is a new program in 6 states, Maryland being one of them, where dentists are going to test patients' blood pressure under a new program. So the takeaway here is to practice prevention. Diet, exercise, lifestyle habits, know your number, know the symptoms of heart attack and stroke, and call 911. So I will end this by saying there are 2 ways to live your life. One is though nothing is a miracle. The other is though everything is a miracle. I want to thank you for your attention.